Do we have a go on the Westborough TV? Yep. So pursuant to Chapter 20 of the Acts of 2021, this meeting will be conducted in person and via remote means in accordance with applicable law. This means that members of the public body, as well as members of the public, may access this meeting in person or via virtual means. In-person attendance will be at the meeting location listed above, which is the town hall. And it is possible that any or all members of the public body may attend remotely with in-person attendance consisting of members of the public. The meeting may also be accessed remotely via, I'll read this, https://meet.google.com/zcq-mswm-FRE, or by phone 1 on local cable, Verizon Channel 28 and Charter 192, and their online platforms westboroughTV.org and youtube.com/westboroughTV. So it's being 5:32. I'd like to open the meeting for the Board of Health, and we have a joint meeting with the Select Board. So I don't know if you guys need to call your meeting to order or.
So it being just after 5:30 on Tuesday, September 21st, 2021, I hereby call to order the meeting of the Westborough Select Board as posted.
So in attendance for the Board of Health right now, we are expecting all 3 members, but we have Dr. Marr and myself at this point. So I think the first agenda item was to have disappeared on the first agenda item. Is this the 5:30 joint meeting? Yeah. Okay. So I think that what I had put on there was a very broad general description of kind of what we wanted to be able to talk about between the 2 different boards. And I think that to introduce it, I'd like to have our director kind of review some of the COVID case numbers and do that before we get any further along into the discussion.
Sure. So would you like me to break it down as I did in the data sheet?
Yeah, I think that would work fine.
Okay.
Jennifer, can you pull that
Microphone, I
right
see
in
it
front of
closer,
you
yeah.
down? Otherwise, it doesn't get on TV and we get yelled at.
So we broke it down using the state census of 2010, which the state is what is based on their numbers. So the population of 12 and over eligible for vaccine is 18,711. The total complete vaccination rate from MIIS, which is the Massachusetts Immunization Information System, where we get our information from, was 15,647 residents, which is at 84% of our population is currently vaccinated. Total with partial vaccinating, meaning 1 vaccination has been completed, is 17,142, which equals 92% of our population. Our daily incident rate of only positive cases is 14.5% per 100,000 residents. Testing rate is currently 13,137 per 100,000 Westborough residents. Number of tests between August 29th and September 11th was 2,458 with a percentage positivity of 2.2%. So we also did it with the current data that we have, which is our total current population, which changes regularly, is 22,033. Vaccinated rate from the MIIS system is 15,647, which is a 71% of our population, including the ineligible. Roughly 19,899 residents are eligible for the vaccine, and 79% of our population is currently vaccinated. Total unvaccinated, including children, ineligible is 6,386, which equals 29% unvaccinated. Total unvaccinated that are eligible for vaccine is 4,242. 2,144 are children estimated by the current census. Roughly 19,899 residents are eligible for the vaccine, and 79% of the eligible population is currently vaccinated. Our daily incident rate of the positive and probable, which we include the probable, the state does not include the probable, is 12.31% per 100,000 a day. The probable case definition meets clinical criteria and epidemiologic linkage with no confirmatory laboratory testing performed for SARS-CoV-2, meets presumption laboratory evidence, and meets vital records criteria with no confirmatory laboratory evidence for SARS-CoV-2. So currently, in Westborough, since our last report, which was done on September 17th, we have a total of 2 positive cases, which are unvaccinated individuals. Total of cases attributed in school transmission this year since the start of the year is 0. Webster Public Schools are using the Test and Stay program, which is keeping kids in school if they test negative daily and being asymptomatic after being considered a close contact in school. This allows the children to stay in school, is what our goal is, for sure. Total cases attributed to spread for municipal buildings is 0. Fully vaccinated individuals do not have to quarantine at this time if they come in contact with a positive person. They are required to monitor symptoms, and I would prefer that they wear a mask, so that is also suggested. So for the month of September, our current total positive case is 68. Of the 68 cases, 46 are unvaccinated, 6 are not eligible out of those 46. 17 are vaccinated, 5 are in congregate care. For the month of September, based on the 2010 census, our daily incident rate of the positive and probable cases is 17.3 per 100,000. State incident rate not using a probable cases, our daily incident rate positive cases is 16 per 100,000 a day. So based on the current census, our daily incident rate in positive probable cases is 14.7 per 100,000. Our daily incident rate of only positive cases is 11.2 per 100,000 a day. So I know some are concerned with the Worcester County information, so I added that as well. So the 14-day average incident rate is 29.3% per 100,000 residents. Case count is 3,441 positive cases. Total testing has been 118,057, and total positive tests is 3,330. Positivity is 3.16%. And change in positivity is lower than in the previous 2 weeks stated from the state numbers.
So to summarize that, in the past week, we've had 2 new cases, and with the best estimates of our population, it sounds like it is about 80% of the eligible population is vaccinated. Is that right?
So it's we've had 2 cases since Friday of our last reporting date.
2 cases since Friday, okay. Okay, and so the 68 is more representative in a 1-month span?
Yes, of the month of September.
Yep, so.
To
like,
today.
It was 35 the week before, right? 35 cases the week before that.
Mm-hmm. Yes.
Yeah, so that would have been half the month's cases in a single week. So all of the other weeks would have to have been less than that 35.
The weeks before that were 21 and 25.
Correct, I have that here.
Yeah. Thank you so much
21,
for compiling all that, and
21,
we all
25,
need to
and
take some
35.
math classes to-
I'm just trying to do the math in my head. 21, you said 25 and 35. What?
Oh, wait, we crossed over, yes, I must have crossed over.
I'm sorry, I don't know what the question was.
Yeah, no, I'm just trying to figure out the weekly totals and whether it's, projecting upward or projecting downward.
It's projecting downward
Okay.
as of right now.
So if you add the 3 weeks, one of those weeks went into August, so we split in the middle of the week. We didn't do 3 separate weeks, we just did from September 1st on.
Okay.
So that's why that count won't add up to that number.
That's what I was trying to do it in my head, and that's always a bad thing to do. So we actually just reviewed the COVID numbers, Alan.
Yep.
And the general trend is that the numbers were going downward. We had to schedule the meeting with the select board and us, obviously, before we got today's numbers in. But, I think that as far as the board's approach, we put on the agenda kind of a wide-ranging list of topics, and hopefully we didn't scare too many people by having the ability for us to have a discussion about these different topics, because I think it is relevant to know what our next steps would be if things got worse and what our next steps would be if things get better. We want to make sure that we're responsive to the facts and figures in there. And so we did put on the agenda kind of municipal buildings, employees, kind of large gathering sizes. And I think particularly with the large gatherings was something that we wanted to talk about with the select board as well. So of those different topics, I think that as far as the large gatherings go, we did have the senior center barbecue, I believe, and wanted to kind of get some feedback if anybody knows how that went, whether, people, it doesn't sound like there's a large number of infections that are coming out of that, so that's actually one good sign. But in terms of the protocols, I think that this was an event that was going to be indoors or partially indoors. It was going to have up to like 75 people. It was, high-risk people. There was going to be eating involved. And so this is kind of one of these large gatherings that, kind of makes us worry as a Board of Health. And so, I don't know, does anybody have personal information from how that went? No? Okay.
Other than they had a great time, and it was pretty well attended, from what I hear.
Good. So people did show up. I just, don't want to make decisions and find out that like they basically essentially
I
canceled
shouldn't
it
say
and no one
pretty
showed
good
up.
time. They had a good time, and it was well attended.
Excellent. So I think that should be kind of forming some of the basis for how things are going here in Westborough, and obviously the different gatherings that are coming up are all going to have different nuances and slightly different behaviors. Do we have a list of which things are coming up that we should talk about
Nathan?
in terms of them?
Just a question. I have a couple questions about the data. I definitely want to get to that point,
Yeah,
but I did want to ask a couple of questions. I
Yeah,
was kind of
please.
waiting to see if the
Yeah,
rest
why
of
don't
the
we
board,
jump to questions about the COVID numbers first?
if that's okay. and
That's
then-
perfectly fine.
So, Jen, thank you very much for the work on the report. It was very thorough, and I like the format a lot because it kind of expressed kind of the interpretation of the data that was very helpful. And some of we just got a new update just before this meeting a few minutes ago, so I'm still kind of processing the updates here. But can you talk, or anybody in the Board of Health can talk about how are self and at-home tests calculated? Is there any requirement for people who are doing self-testing right now to file with the town or with their doctors that then gets included in the data?
No, that's not actually included in the data.
Okay.
It is suggested if we know that someone tested, or if the schools know someone is tested, they ask them to go get a PCR test, and then it will be included in the data.
Okay. And
So I'm sorry, the school tests are not included in the data?
No, not unless they're positive. So the negatives aren't, but the positives are.
Okay,
But
yeah.
the home tests are
Right,
not.
right, sure.
Yeah, and I believe the instructions for the home tests, at least based on the CDC and FDA requirements and guidelines for those tests, are that you are supposed to give your results to your local physician, and if you don't have a physician, then you're supposed to provide the results to the local Board of Health for positive tests.
Sure.
And so we should get notified either directly or via the physicians going in through the normal channels that any sort of test would go through.
If people that are doing what they're supposed to be doing, absolutely, that makes sense.
It sounds for certain they are in Westborough. It's fantastic what the numbers are right now.
And then I guess one of the data points, I don't know if it was in that last report or not, but there was mention of municipal buildings and the infection rate in municipal buildings. I'm just wondering what the likelihood is of being able to accurately ascertain if someone contracts COVID while in a municipal building. An example would be a mother who may have been out for the day doing errands at many locations, one of which is the municipal building. How does that data get captured? How do we know what location somebody contracted something from?
So that's where the contact tracing comes in play,
Yeah.
and that's where the investigation starts and how it's figured out.
So in that event where they've gone to numerous places, how is it again ascertained that municipal building gets a check mark as that was the place of infection?
Well, you have to remember, you have to have 15 minutes of direct contact for less than 6 feet. We still follow that rule. So normally when you come into a town building, you're really not spending that much time in here. And there is plexiglass and borders in distance from customers. So that's one way.
In my experience with patients, the vast majority of them who are positive know that they were exposed to someone who's positive, that it's not happening via strangers per se. There obviously at mass gatherings where you have these super spreader events, it's certainly the case, but then, you know, in those situations, people know, well, I was in Provincetown over that 4th of July weekend or things like that. So most, and I have not been doing the contact tracing, and I know, Ray, you've certainly been doing a fair amount of it, but that's my experience, is most people have a pretty good idea where they picked it up. And
That's also my experience.
that's yours as well?
Yeah.
Jen, can I just clarify something you said? Because, so our cases right now, 17, I mean, obviously it depends on which number you look at, you know, what our population is, but, you know, 17 cases per 100,000 population per day, that is still considered moderate transmission.
But we have to remember that's over for 100,000 residents. We
I
don't have,
understand.
yeah.
I know,
so-
but when you look at the definition of transmission and, you know, low transmission, moderate transmission, high transmission, that is considered in moderate transmission range. From my research, I mean, from talking to people, that is considered moderate transmission, as is, you know, all of Massachusetts is certainly considered in high transmission, and almost every town in Massachusetts is in the moderate transmission range.
I look at the testing as well, and we've had, for Worcester County, are you looking at county or town?
No, I'm looking at Westborough
Can you
and
speak to
West,
the mic?
Oh, sure.
you know, Westborough and, well, Worcester County is obviously significantly higher at 29. But
Right, so I don't have the data in front of me, but it is certain that people are getting tested if they're even questioning whether or not they are having symptoms or if they think they have COVID. So I think that speaks volumes with the number of testing we have compared to what actual positive testing result we get. So I think that needs to be looked at as well, because that is a
Yeah, so I think that there are
informative.
two parts to this discussion that's going on. One is just kind of what is the volume of new cases, and then what is the error kind of around that number. And I think that what, Jen, you're getting at is that we have a high testing rate, and so our error is on the smaller side. But I think to Dr. Marr's point and Patrick's point is that the number of new cases at 17-ish, you know, per week is still.
per day.
Oh, sorry, per day.
17 per 100,000 population
Per
per
day.
day.
Okay, yeah.
Translates to a little over 2.
Wait,
to do
there's
the math right.
something the matter, I think, with that. Is it-
No, it's
That's
right.
what it is?
That's
I
right.
think
mean,
that
if you
because-
look at all of the data, you know, CDC, mass.gov, you know, definitely the number moves around because our census data is not accurate, but
But that is for the 2010 census data. So for the current caseload in the current census, it's 14.7 per 100,000
Yep.
data.
Yeah,
Yeah.
and so it's not, you know, 1 or 2, it's, you know, whether it's
Mhm.
14 or 17, you know, it's in that, you know, range that I think that you're saying is in that moderate range as defined by the CDC.
And I think we have to remember that we're also counting probable. The state doesn't count probable. So our current census data is more accurate than 2 weeks ago with the state data that
Yep.
doesn't count the probable.
Right, but that translates, just did the quick math here, at that number, that's 2.94 cases per day in the town based on our population. So translate that over a month, over 30 days on an average month, you know, you're talking in the 70 range of new cases every month.
And last month, our numbers were 68, so that actually
Right.
matches up pretty well.
But the increase, just from the last report that I saw, we went from 21 cases to 33 cases? That's
35.
35 cases, that's a 1.67 or 67% increase just in a 1-week period. So if you take that and you extrapolate it out, it's more like 110 cases per month, not whatever I just said, in the 70s.
But if we're only at 2 for the last 5 days,
That's correct.
Right.
Over the last, so that's
Very
encouraging information.
very
Right.
encouraging versus the 35.
I don't have it in front of me, but kind of the shape of that curve seemed like we had gone from the summer where it was actually really low to an increase and then a plateau, and now potentially it's dropping, and we're still, when you look at these numbers, depending on how wide that graph was, it could explain why you know, the numbers are still high, but maybe they're trending in the right direction. And so,
Well, you know, I also just question, like, you know, obviously this is kind of a rolling, you know, we're getting data in as it comes, and, you know, it depends on when you get that data, how it looks, so we're just taking it as we're getting it. But I guess I had a couple other quick questions here, hopefully, that you can help me out with. How are college students that are sent home with positive test cases calculated in the town's data?
It is calculated because the college that they attend are required to notify the local Board of Health where their actual residence is, so they are counted in these numbers.
Okay. And how many elderly in our town that cannot be vaccinated due to pre-existing health conditions out of that roughly, was it 4,242?
That's not data I have access to.
We don't have that data?
No.
Okay.
What was your question?
I'm wondering how many people, elderly in our senior community who cannot be vaccinated represent of the 4,242.
yeah, and I'm not sure that data is provided to the Board of Health, so I'm not sure we'd be able to even get an answer to that question.
And we also had, if I know correctly, I think over the last couple of weeks, that we've also had 4 deaths in town. Is that correct?
All congregate care.
All congregate care. Can you define congregate care for me?
A living area that is taken care of by, people are taken care of by others.
So a community of people who are being taken care of by others. Okay. You know, that's to me, that's a significant number because we went through a pretty significant period where there was no increase. We were plateaued at 62 for quite a while, so I was a little concerned about that. I also just will reiterate from the last time we met that every single county in the state of Massachusetts and all border counties in Rhode Island, Connecticut, and New Hampshire are all at high risk. They're at the highest warning by the CDC right now. So, you know, we are surrounded, and if you look at the map of all the towns in Massachusetts, the 2 concentrated areas right now are central Massachusetts and southeastern Massachusetts. So I'm encouraged by the decrease, but I'm not too optimistic that we're not just seeing a short, I'll say, dip in because of who knows what reasons over a short duration that we just went through. So that's just some observations there.
But one more observation is that when you look at the county-wide numbers and you start to factor in the cities where you've got large number of, I think, a combination of factors, apartments with close living quarters, you've got a higher unvaccinated rates, and the combination of those cities like Worcester being part of our, county, does make the whole county look, red or whatever.
Well, you got to remember, and Christy, you can certainly correct me if I'm wrong here, but I believe Westborough has the 2nd highest concentration of rental locations in Worcester County. So there's a significant population in our town that falls in exactly that kind of category.
I'm sorry, what's that statistic that you
I
were?
believe we are the 2nd most densely populated rental community in Worcester County.
I'm not aware of that number, so I can't comment on it. But I would say that even if that was true, Westborough is actually doing significantly better than Worcester, and it's more like its immediate neighbors like Northborough, Southborough, Grafton, and Hopkinton. Those towns actually, last month at least, were doing very similar to the way Westborough is doing, and drastically different than the way Worcester and some of the other surrounding places are doing. And so when you look at some of these places like Framingham on the other, in Middlesex County, they kind of drive the numbers for a lot of the towns. And so county by county is not a very clear picture of how this virus is manifesting itself, I would say. It's unfortunate. I think all the CDC data is based on counties, and so it kind of paints all of Massachusetts except for, portions of Western Mass as, bleak, and maybe it already is red all the way across. But I'm not sure that county by county is a very accurate depiction of an individual's risk in being in Massachusetts.
But you also have to remember, we don't live in a bubble. People work and travel, out of and into Westborough, and do, sports, and, kids are mingling. And so I think by thinking of Westborough as a bubble, even though our numbers are lower than some of our surrounding towns, I think that's a mistake to think of Westborough as a bubble and not consider the surrounding towns and how close we are to Worcester and honest, and like I said, before, the level of transmission we have, even though it sounds low, well, 35 cases is the highest we've had in a long time, and that was the last full week that we have. And it might sound low to 18,000 people, but in the definition of transmission, that is not considered low transmission. So we, most infectious disease specialists, want that number much lower to consider low transmission.
Can I add something else?
Sure.
Ray actually just reminded me. The numbers from last week is also 2 weeks after Labor Day, which is a spreader event, as we know. So just keep that in mind as well.
Thank you.
Thank you.
Alan, do you have any comments on the discussion? You've been noticeably quiet.
Well, first I apologize for being late. I've been on Zoom calls all day, and it just, in my mind, I had it, there's just one more Zoom call at the end of the day, and then I forgot we were in person. There's no doubt that the case counts have gone up. In Westborough, the pattern there has, to some extent, mirrored what's happened in the state, which, is better than the country as a whole, but also you look at the state data, and that's gone up. It is unfortunate. We've had a few deaths. They have been in older individuals who are significantly at increased risk, and in response to some of the outbreaks that we had in some of the nursing homes, there were calls set up to try and make sure appropriate infection control policies were being put in place to limit that, and to the best of my understanding, that has gotten better. I like to focus as much on how many people are in the hospital or the deaths compared to just the cases, because we're doing a lot of testing. There are going to be cases, we know there are breakthrough cases in vaccinated individuals that are not things that are causing most of them to be particularly sick. And so, I don't know that focusing strictly on the case counts is the best measure of how is the disease impacting the community. What is it that we need to be focusing our attention on addressing? And so, those are just some of my thoughts. Right now, at least as of the last report, there was nobody in town who was being hospitalized from COVID, which is a good sign because most of the deaths follow hospitalizations. And so if nobody's in the hospital, that generally bodes well, although that we had a couple deaths despite that, I think, in the last report. So every death is something I think we as a group need to take very seriously. But I guess the bottom line for me is I want to prevent those deaths, and I want to take measures that are most likely to make a difference there. I don't want to necessarily take actions because it's easy to do if it's not going to have an impact on the outcomes that I want. And that's, as we're contemplating various steps we might take, that's where I would want to focus. How likely is this to reduce the vulnerable people from getting infected?
Sure. And I echo a lot of your points, Doctor. I would just say that one of my biggest concern is flat out one case is too many, in my opinion, in this town. We need to do our best to eradicate this completely, just like we did with smallpox over the years. Get rid of it. What I don't understand, and I don't know if you had gotten here when I asked this question yet, but I was asking specifically around how many of our elderly or senior community cannot be vaccinated because of pre-existing.
I did hear that question. I'll give you an answer that's a little different from what Jen had. I don't know the number either, but I can tell you that there are very, very few conditions as comorbidities that would prevent you from getting vaccinated. Mm-hmm. There are allergies to the vaccine that's going to be equally distributed amongst all populations. The elderly are not more at risk for that, and those are very rare. The problem with comorbidities is not inability to get vaccinated. it is potentially a decreased response, immune response to the vaccine if you're getting chemotherapy or something else that's suppressing your immune system, but you're still eligible for the vaccine. And these are also the same people who are getting the booster doses at this point in time. I will say I disagree with you about one case of COVID is too many, because I think that prioritizes an aspect of healthcare over all other aspects of things that we do in our everyday lives. And so, we don't take the same approach with influenza. We don't say one case of influenza is too many. During flu season, influenza kills people. And so I think we have to address trying to decrease the impact of the disease, which is very different than simply saying we will have no cases of COVID.
But the only way to decrease hospitalizations, which we don't have right now, is to decrease the total number. So, by answering, your question, you want to make sure that we don't have hospitalized patients. And certainly by having high vaccine rate, which we have, which is wonderful, but it seems like we need to have more. We still have people who need to get vaccinated. I think the number that we had been reported at the last meeting was much higher than the number we're getting now. So there are definitely people who can still get vaccinated, which will decrease your chances of having hospitalized people and decreasing the total number. I mean, those are the only two things, that we can do to decrease the hospitalizations.
Well, I mean,
Okay.
just to, take that a step further and play the thought experiment of what if we had some policy in effect in Westborough that made it so that transmission wasn't happening at all in Westborough. Now, people are still going to travel to other towns, and then they're not bound by our rules and still could pick it up. They could still come back. We would still have cases come up in Westborough, even if we had really, really strict policies here in Westborough. And that wouldn't really change the amount of new numbers. The policies that we want in Westborough, we want to deal with transmission within Westborough, because that's where the policies are going to have an effect.
So I understand where you're coming
And
from.
Christy also wants to jump in too, Patrick, if you don't mind.
Excuse me, I don't want to interrupt your conversation. As a reminder, the select board is actually going to another meeting at 6:30, and I think they were hopeful that we could talk about town meeting,
Yep.
if that will fit in your agenda.
Thank you.
So just one final thought on your thing. Yeah, Nathan, I understand and completely understand where you're going, and certainly that would be a great hope. But the fact is that if every town took that position, there'd be no hope of actually ending this pandemic, because every town took the, I'll say, laissez-faire approach to this. We'd have an even larger spreading.
Right, so maybe the goal is that if we're all trying to be better than our neighbors and drive it down within each individual town, that would then, bring everybody to where we want to be. And so I think there is some sort of, goal in there, is that we want to make sure that our policies that we have in town are so that we're not a spreader event for COVID, and that we don't have transmission. And maybe that's actually a good segue now back from the numbers into talking about the meetings that we have planned. As Christy just mentioned, we have the town meeting, which is one of the events that's happening here in town. And I believe there's a number of other events as well. And maybe we can just kind of read through that list so that we can kind of get the scope of what we're talking about. Do you have that, Jen?
Sure, yep. Town meeting, which is occurring on 10/18. Arts and Common Festival, which is an outside venue only, is on 10/2. The Fall Fair, which is at the Senior Center, it's an inside and outside venue. 10/26 is Main Street Trick or Treating. Multiple businesses and town departments are involved in that. 10/29 Recreation Halloween Party at Gibbons Middle School. It's been recommended that they follow the DESI guidelines and wear masks. On 11/6, the Fall Fair at the Senior Center. It's a rather large event. And 11/10 is the Veterans Lunch at the Senior Center. It's a sit-down luncheon with speakers. It is inside. And 11/23 is the Community Thanksgiving Dinner, where Thanksgiving dinners are delivered and also have a sit-down luncheon. So those are some of the ones that have been brought to my attention. Oh, also the holiday stroll on 11/28, which kicks off the holiday season, and it's basically based on Main Street. In other areas that you take buses to, so it was guidance was wearing masks while you're on the bus to follow the DESI guidelines. And 12/14 is a holiday party at the Senior Center with probably around 100 people there. And it's a sit-down lunch, music, and possibly visit from Santa.
Just one more to add, which would be the Veterans Day Parade and the planned dedication of the Blue Star Memorial on the same day, outside.
So I think that a number of these events, I'd kind of like to break them into the ones that are outside versus the ones that are inside, as I believe there's a much bigger risk for indoor events than outdoor events. And certainly I think that there could be some guidance that we can give about outdoor events, but I'd like to spend more of our time focused on the indoor events. And so within the indoor events, there are the ones where people are eating and sitting in tight quarters, and then there are other indoor events where things are a little bit further spread out. In the past with our town meetings, which has been an indoor event, and we've had during COVID and been able to successfully have meetings even before we had vaccinations. And so if we were to approach it from the same way that we have in the past, I believe it could be very safe and well done. And the question is whether we want to revert to kind of pre-COVID restrictions or if we want additional restrictions added in right now. And so I want to kind of hand off.
What do you mean by pre-COVID restrictions?
In that there were no restrictions. We basically didn't have, any sort of chairs.
Do we remember back that far?
So lack of restrictions,
Okay.
more similar to pre-COVID times, I
Okay.
guess is what I was trying to say. You guys have any comments on town meeting?
I do think you have a situation where you have successfully run town meeting without any significant increased risk. We, at that time, employed a combination of social distancing and mask wearing. Now we have vaccination on top of that. So, again, there were other things that were done to make town meeting safe, which had to do with limiting the duration of town meeting. They tend to be shorter than some of our ones have been in the past historically.
And a number of other little protocols, like how we line up and spread out.
Yeah, there was that kind of
there's
stuff.
A number of other little things like that.
And my feeling is we probably don't need to be 100% as strict. I think if we used the social distancing, the mask wearing, and the high vaccination rate, that's probably sufficient, meaning you don't necessarily have to have people come in single file, 6 feet apart and whatnot, that type of stuff.
I mean, looking at what's going on in our schools right now, where we really don't have much social distancing going on, and they're doing so well, I think, by masking for a big town meeting, you're really going to protect people, especially in a town as vaccinated as us. That's my recommendation.
Christy, do you know if we have the gym available for the town meeting? I know in the past we've been able to use that. I know that now sports are starting to kick back in, and so now there could be some issues in trying to get that space. I want to try to balance the needs of the town or the needs of the school and the needs of the kids. And so do we have a venue that would be appropriate for town meeting if we wanted to kind of keep that social distancing and masking?
Yeah, I mean, I'll confirm with Wendy, but I think that we expected that we would use the auditorium as well as the gymnasiums again, so.
Is there a reason why we can't adhere to social distancing in the auditorium? It's a much more effective, comfortable setting. And in terms of the crowd size that we typically get for town meeting, I think there's ample room to spread out. I would prefer to see the auditorium as our primary location and, another room or something for overflow.
Yeah, I think that when we had done the numbers, and I don't have them in front of me, the gym, I think, could fit about twice as many people as the auditorium. And so in the past, we had used the gym as the primary room and the auditorium as the overflow when we tried to have that 6-foot distancing for spacing.
I don't think we need, I don't know if we need the spacing. If we're masking.
I think that you're probably right. We can get by with a lot less than 6 feet.
I'm presuming masking, and again, I think that people tend to sit in their pods, however they define it. And to your point, Dr. Mard, that, I think that the students and the educators are a model for what is working well, and I would be very comfortable in recommending what I just put forward.
I'm okay with that.
Yeah, so I think that if we wanted to look at the auditorium as the main space for the town meeting, and possibly another room as overflow, just in case a large number of people show up, I think it's always wise to kind of plan for overflow, as opposed to just packing people in really tightly, which could actually drive some people to not want to participate. Yeah.
Just one thing to remember too, I think we did offer a third room for the town meetings for those that did not want to wear a mask. I think we were using the music room as a third room for that, if I'm not mistaken.
The first one. I'm
Yeah.
not sure that we had anyone.
I would not be in favor of that. I think if you want to come to town meeting, you wear a mask. Our kids are required to wear masks. I would not be in favor of that.
What if someone can't wear a mask
Can they,
from a health standpoint?
Can they
watch
participate
it from-
remotely in town meeting?
you
No.
can't.
Okay.
Fair point, Ian. I just think that that's probably a very, very small number of people.
Yeah, so I mean, what we had done in the past, yes, was I think in the first town meeting where we had the music room set up, and I think that what ended up happening is that there was nobody in there that wanted to not wear a mask. The people that went in there were just ones that felt crowded in the other room and wanted to go take more space. And then I think the next time we had a corner of the gym that was dedicated to people with no masks. And again, nobody even asked to be present without a mask. So I think that we should designate the main room as the room with masks, and that you have to have a mask if you want to be in the auditorium. And that if it turns out that we have the gym and it's set up, or some other room for overflow, that we could put, in one portion of that, people without masks, if they, couldn't wear a mask because of physical breathing issues or something like that. So yeah, I think that seems like a pretty good recommendation from the Board of Health.
Can I just remind everyone that John is actually on, the town moderator is on the
Oh,
call.
actually, if he's on, I'd love to hear from John.
Can I just remind everyone that John is actually on, the town moderator is on.
Oh, actually, if he's on, I'd love to. Yeah. Hi, can you hear me?
Yes, we can.
Yes. He has to turn off the audio from Westborough TV.
Hi, can you hear me? Okay, yeah, sorry, I'm a little bit on delay because the sound quality was bad on the name. Yeah, I did. That's not from me. Okay, yeah, sorry, I'm a little bit on delay because the sound quality was bad.
John, you need to mute the Westborough TV.
There we go.
Okay, let's try this now, and let me just do one setting. I can't hear you right now because I have the sound off, but give me a second. But somebody can always, hang on. Okay, now I can hear you. Okay. So my question is, that's going to be terrible. Turn my speaker.
We can hear you. Go ahead.
Turn my speaker up. My question is that if we want to go with the main room in the auditorium, it sounded like people were drifting toward less distancing, and I'd just like to know if maybe at some point we could figure out what the distancing would be so we can map out where people can sit and increase the likelihood that all the voters who want to be in the auditorium could be in the auditorium. I still want a second room, but I would prefer to know if we're only going to be able to fit 60 or if we can fit 80 or 100 or what.
How many does it normally fit?
Weren't we talking about no distancing if we're requiring masks? Allowing people to
Right,
sit?
that's what I'm saying.
500,
Oh, okay.
around that, 450.
And how
500,
many people typically come? Do we have that number?
200?
Okay.
My advice would be to just have a seat in between either individuals or couples. Many people come as couples or, a living group, and have them sit together, but between them and any other group, make sure there's an empty seat.
And since we don't know how many singles, doubles, or triples, maybe just signage that says, please leave an empty seat between you and your neighbors.
Yeah.
Yeah, I think that most people, especially if we had signage, but I think just most people in general are going to be sitting a person away from, somebody that they're not sure of, what their status is. So, as you said, units, people that are hanging out together outside a town meeting may choose to sit together. I'm not sure that it's a huge risk if they're wearing a mask during the whole town meeting. I think I would discourage people from, bringing dinner and eating during town meeting. But, just to kind of keep masks on as most of the time as possible. I mean, I think if people have to get a sip of water because they're talking a lot and, need that, a quick pull down the mask, take a drink of water and, keep the mask back up, I think is entirely appropriate. But I think people can, to some degree, figure out their spacing without necessarily marking it off. And I would think that might make setup easier, John, but it could also, we'll have to see how it goes. I think people can make.
That's very helpful. We can certainly put up a slide that tells people to try to maintain at least 1 seat's distance between family or friend units. That's very helpful.
Good. And so now taking it from the easy case now to some of the other indoor events that we have planned, especially those ones with eating involved. And we can't necessarily have that same sort of, coherent strategy of everyone's wearing a mask the whole time while they're indoors, if they're sitting down and eating. And so some of these groups, especially the elderly community that might have more risk.
When is the first one?
They already had one too, right?
Yes, we did.
Yep.
Yeah, there's the fall fair, which is inside and outside the senior center.
So that
But-
includes eating, though?
Oh, eating, sorry. That would be
Veterans
I have
lunch,
the veterans lunch,
November 10th.
November.
November 10th.
November 10th.
I think we have time.
I know, I wonder if we should revisit that, if that's like the first sit-down eating event, rather than make a decision on that now. I mean, the fair, is the fair where people are going from table to table type of thing?
Yes.
Okay.
Yes.
One question to backtrack slightly, and that's the 2 people from the congregate care setting that had passed away. Do we know if either of them were at the event with the senior brunch? I mean, is that a possible spread event, or was that just within the
No,
congregate
it
care
wasn't.
setting? Just within the congregate care
Just-
setting?
I'm here.
Okay.
What's the question?
So the question, without getting into any very specific details about the people that died or anything, I'm getting a shake that this
No,
is,
That's Alma
crossing.
from the senior center. She's wondering,
I'm the director of the senior center. To the best of my knowledge, none of the people that passed away, they were either in nursing homes or assisted livings or whatever. They weren't
Okay.
regular home, live-in home, yeah.
right, okay, good. I just wanted to try to, make sure there was, the data
Yeah.
we're trying to pull from the prior event that we had that happened, that there was not increased risk from, increased deaths from that. And that seems like it's the case, that there was not an increase related to that event. So in terms of the brunch, yeah, we could table it. I mean, I think that if we think, though, that it's something that couldn't happen safely, it would be better to kind of give that advice up front so that people could kind of prepare. I think at this point, with one event that's already happened successfully, and my feeling that these numbers are trending downward, but could still spike up if, things happen, I'm not sure that we need to kind of cancel it today. And I think
Nathan,
there's probably ways to make it safe.
Just a question, I'm just wondering if we should try to lump these into, I think we've kind of started down that path of large gatherings, indoor, outdoor.
Yep.
I'm concerned that we're trying to customize to every single event, and that there are events that are not necessarily town-sponsored, town events which might have large congregate groups of people getting together.
Yep.
Should we not be providing guidance kind of in I'll say a holistic way, categorize it indoor, outdoor? Hey, if you have an indoor event that's large, here's the mandate. If you have an outdoor event that's large, here's the mandate. I'm just trying to slice it up a little easier for us.
I believe we have
that's right.
guidance existing for large events or gathering over 100, which is over 100 people, outdoors and indoors, dating back to July 30th. So outdoor, there's no guidance for large events at this time. And then the guidance from the Board of Health as of July 30th was advisory for vaccinated individuals when indoors, a weakened immune system, if that's a consideration, or increased risk for severe disease, or if someone in your household meets those criteria, or you're not vaccinated. And so I think there's already guidance established. So discussions.
Maybe we should pick a
do those
number
need-
of,
Do those need to change?
Right.
Or do you want to say make that down to 50 or something like that?
yeah, I'm wondering if we should pick a number, whether it's 50 indoors. I mean, I do feel like it's a little premature to cancel things for November, though. And
So,
I'm sorry, the senior center activity, the last one that you had was vaccines required?
So, the information that I've gotten from the state, no, we don't require them, but the information that I've gotten from the Executive Office of Elder Affairs is that 95% of the population in Westborough over 65 has been vaccinated.
I do have those numbers here if anyone's interested.
Yeah, and so in our big room, the total capacity for that room is 250. So even if we split it in half, we still would be able to cover. And we've taken precautions. I mean, instead of having 8 or 10 at a table, we have 6. We've spread the tables out more. We've done everything that's been asked of us. And to the best of my knowledge, after going through our summer programs and even starting up some of our other programs now, we haven't had any problems. So I've heard of no one who's gotten sick from being at the senior center, and I guarantee you I'd hear about it the next day. So.
yeah, I want to address your comment about should we have a broad mandate to do this more as one-offs. And I feel like there are some one-offs we need to address, and the single biggest one, in my opinion, is the Thanksgiving dinner at the Knights of Columbus. For a variety of reasons. It's a big deal event. It's very important. It's important to the people who go and attend who might otherwise not have a proper Thanksgiving meal afforded to them. It's also a situation where in the past it's kind of crowded, okay? And so, then it requires planning and coordination. I see we have Joe, who's going to hopefully enlighten us on some of this, but he needs advice on, because it requires so much advanced planning, where we stand, and perhaps we could ask him to come forward and perhaps give us some perspective.
Yep.
Excuse me. So, is that not a town-specific event? The guidance for that would come from the Board of Health and not from the Select Board. So, is there anything else we need to cover that would require action by the Select Board potentially? Because if not, I would motion that the Select Board adjourn and let the Board of Health continue on with the meeting.
So let me just jump in then and say that if there are things that the select board wants specific guidance on that we should continue to talk about, we can do that. I think Patrick had brought up can the Board of Health give some general guidance about, general activities? If you guys want to be part of that discussion, then we can try to figure out how to make that happen. If you want us to just talk about it and make some guidance for you guys, we can do that. And then if there's any specific events that you want us to comment on while you're here, we can do that too, because we are down to the last few minutes that you guys are here with us.
I'll look to head nods from other members of the Select Board. I'm comfortable with the Board of Health discussing, making recommendations. If we have questions or concerns or follow on, we have other opportunities over the next several weeks to jointly convene
Good.
I would be
and
comfortable.
discuss.
Go ahead.
I was going to say, I'd be comfortable with that too, Alan.
Okay.
Yeah, myself as well. I just had a question, and I'm not sure if anybody has the answer here, but I think as you go through and discuss things and talking about indoor, outdoor, whatever events that are town-sponsored or non-town sponsored, or the broader piece is like Worcester mandated, I think, that all indoor facilities
Right.
need to be masked, I think, now.
In town and in Worcester?
In Worcester itself. So I
Worcester.
guess that's where I'm going is,
Yep.
as you think about things, is it, it's more of a question, can the Board of Health say, hey, we want to do this for town stuff, but not, for municipal purposes, but not for the broader town? Or does it have to be
Yeah,
more?
Absolutely. I mean, there's a lot of towns in Massachusetts that have municipal building masking, and not the whole town, absolutely.
Right. But the question, is that the Select Board's responsibility, the Board of Health's
So actually, I could do that mandate without either board. But certainly, working with both boards to follow your recommendations. So, I think that if you want to have the conversation, I can stay for that.
I mean, I think that for us, giving guidance tonight is going to be one of the key issues that we do. And if we gave general guidance that, for instance, the whole town should do it or that the municipal should do it, then it might fall back on Christie or the select board to then follow up with that action. If it's about us approving a permit for food for a particular event and it doesn't match our guidance, then, that might be more of what we would do tonight. I mean, unless the other members of my board think that we're going to take more severe action and do any sort of mandate rather than guidelines, speak up before the select board leaves tonight. And, it doesn't mean that we might not revisit this at a different meeting, but the question is whether we want something like that for kind of big town events. I don't hear
From my perspective, I feel like we should continue monitoring the data. But I'm not ready to make any change to what our advice is at the moment.
I mean, I think as I did at the last meeting, I do think we should be masking in town buildings and town meetings. I think, for people to be able to go into our buildings and go to meetings and feel comfortable if they're immunocompromised or for whatever reason, I mean, people should feel protected in our town. And I do think, since looking at that week, our last week of numbers of 35 cases, it's concerning. I'm certainly hoping, we're not going to continue to go up, and the first of this week looks good, but I personally think we should have a mandate for municipal buildings.
Okay, so that gives you a sense as to where the board is right now. You guys can decide if you want to close your meeting or continue to stay part of this discussion then.
I'll move to adjourn the Board of Selectmen's meeting.
Is there a second?
Second.
Moved in second, we'll vote. All in favor of adjourn? 4-1, 5 being present. So we're adjourned.
Thank you.
Thank you. I mean, if anyone else on the board wanted to stay as a member of the public, they're certainly welcome to, but obviously we realize that you guys have other meetings. Yep.
Have fun.
Yeah, so I think to then follow up on Dr. Marr's point about, the masking and what kind of guidance we can provide, I'd like to think about, those sorts of size ranges that we'd like to do. And we have, is this Joe that's up at the podium? If you want to introduce yourself, then we can kind of hear a little bit about this next event that we're talking about.
So I'm Joe Cucciarelli. I live here in Westborough. For the last 10 years, I've been the chairman of the Westborough Community Thanksgiving Dinner. By the way, this year's event, should it be held, would be the 50th anniversary of that particular event. We obviously didn't have it last year. So I've been intimately part of the planning and for the last 10 years, so I'm very familiar with the mechanisms and processes. First, I want to say that we recognize that the situation is fluid and the world may change, and we are ready and intend to adapt to that as the situation changes. So what you're hearing from me is preliminary planning based on an assumption that the world is either the same or better, and if things change, well, we're going to adapt and change. So that's the presupposition of where we're starting from. So that's number one. Number two, you should be aware that many of the people that are in the planning process and will be executing on the Westborough Community Thanksgiving Dinner are also individuals that are cooking meals at the senior centers with Alma and have been following the protocols since this whole situation began and are quite familiar with those protocols. So again, we've got a crew of people that are experienced, but here's what we're thinking about. Typically, when we have a community Thanksgiving dinner, we typically sat 140 people in the hall, okay? We typically sent 50 hot to-go meals. And then typically of the servers, which we had, a number of people in the facility who were serving and cooking, would also eat. So for starters, what we're going to do is we're contemplating no hot to-go meals at all on Thanksgiving dinner, Thanksgiving Day. So that eliminates 50 people or 50 meals to go. Alma is going to be doing something on the Tuesday before Thanksgiving, which is what was done last year, as a substitute. So there'll be, we're contemplating no hot meals to go on Thanksgiving Day. That eliminates a large number of people from the process, a lot of complexity. That's number one. Now, when we get to the main meal, what we're contemplating is reducing the seating to 75 people. Number two, we're contemplating a plan where every attendee has to register beforehand using the senior center process, which we have been using for more than 10 years, only we're going to be very strict about it. That's number two. Number three, what we're going to have is require all the volunteers to either to be vaccinated and to have masks, so the people that are serving and cooking. We're going to be changing the method by which we serve the food. Traditionally, what we did is we serve family style, where you'd have bowls of food put on the table and people would pass bowls. What we're going to do is serve plated food, so that the people that are at the tables, and again, we're going to be at half the capacity. We'll have people spread out. We'll have the servers masked. We're going to serve the food fully plated so that nobody will be touching bowls of food and handling the bowls of food. It sounds like a small thing, but surprisingly, people ask for seconds on Thanksgiving. So when they ask for seconds, we're going to give them like you do in a restaurant. You're going to get another plate of food with one standard set of portions. Again, these are minute details, but the level of planning that we've already had, you may be aware we have a dessert buffet at the front of the room. Well, there's going to be no dessert buffet, okay? There's going to be no home-cooked pies. What we're going to do is we're going to purchase the pies commercially, and we're going to serve the pies and portion them, and what people are going to get is either a single serving table talk pie or a portion of a commercially baked pie from probably one of the commercial bakeries or one of the grocery stores. In terms of, again, it's Thanksgiving, so leftovers are a priority. Everybody wants a bucket of leftovers to go. What we're anticipating doing is no buckets of leftovers to go. What we'll do is we're going to be serving people on disposable, hard plastic, single-service, Chinette type plates. If somebody wants to take some food home, we're just going to take plastic wrap and wrap the dish that they have, and that's it. So there'll be a minimum of people handling food and portions and all that kind of stuff. That's basically what we're envisioning at this point. So reduce the number of people, reduce the hot-to-go meals, get rid of the baking, simplify the process significantly. It's my expectation as an organizer that those changes are probably going to eliminate 65 to 75% of the number of volunteers that are involved in the process. And that actually is a big deal. I'm actually anticipating that is going to create more social conflict at the Knights of Columbus Hall on Thanksgiving Day than the people coming to eat the food, because I'm going to have to put, door guards, if you will, at the front and back of the hall, basically preventing volunteers who just show up in the most gracious of spirit. People show up because they want to serve. And I'm going to say, no, you can't do that. We're also going to be minimizing the number of people involved in the process. So typically we would allow families to come. So you'd have, the parents and children, and the kids would be, there, and it creates a sense of conviviality and family. We're not going to do that. We're going to minimize the process. So we're going to have half density at the tables. We'll probably only have 1 or 2 people for every 2 tables. So again, the number of volunteers involved to cook, serve, clean the thing is probably going to be a small fraction. So I'm going to stop talking and give you an opportunity to react for what we forgot.
Can I ask you about the to-go meals? Did you say you're going to do something a few days ahead of time?
Tuesday afternoon.
So that's for people who, and you did that last year?
We did.
Okay. And that's wonderful.
And what we're going to deliver is basically turkey pot pie, the senior.
We're going to do turkey and stuffing and mashed potatoes and gravy and squash.
But it'll be done not on Thanksgiving Day, which radically reduces the complexity, the crowding at the hall, which has, frankly, the last time we did it was 2019. We're physically at the very boundaries of the facility that we're working in.
So first of all, everything you're saying sounds like, perfectly safe and appropriate, and I don't have any qualms about that. I think my question may be a little bit of a follow-up to Dr. Maris, which is, of the various things that you're not doing, handing people to-go meals is like, that part's the least dangerous. Now, I understand it requires more volunteer staff, and that's the concern that you've articulated. I thought you said a lot of the meal prep is taking place at the senior center, or is it?
Actually, what I said is the individuals that are cooking the Thanksgiving dinner meal
are
experienced at cooking meals at the senior center, so they're used to the protocols and the safety and cleanliness processes.
Fine, okay, I misunderstood, thank you. Yeah, because it's nice to give people the meals on Tuesday, but it's not quite the same as getting a hot meal you take home. And, again, that's the least, from the point of view of a potentially vulnerable senior coming to get a meal, if you had 100 people or getting hot meals and 50 people at the hall, that might be better than, whatever. But again, I'm not going to second guess your decisions about how to run that. There's nothing you've said that sounds worrisome to me.
When I think about this, this is very much a community activity, and the people that come are people that largely really need this and want this social interaction. And at the same time, they're many of the most vulnerable people. So it's a matter of balancing and weighing this. And we understand, we recognize that, and what we want to do is we want to deliver and execute a very safe experience for everybody involved. For us, that involves not doing the hot meals on Thanksgiving Day, just because that reduces the hall density, the planning, and the number of people that are involved.
Can I say something?
Sure.
Joe, I just wanted to say that your plan is fantastic, and I'm impressed with it, for sure.
Well,
And I
thank you.
think we definitely need to look at the mental health status of this as well. So I just wanted to make sure that we're all keeping that in mind, because with seniors, that's very important, as you know.
Yeah, no, I think your plan is wonderful, and I can only imagine, wanting you to change it if numbers go up dramatically in town. I totally agree with volunteers and masking, and you said making sure they're vaccinated. I think both of those things would be perfect. The only other thing I would consider recommending is that people who are going to this event be vaccinated. I think that would be, if 95% of our elderly, and it's more than just elderly, I know that are going to this event, but certainly our town is highly vaccinated, so I don't think you'd be isolating too many people, but I think it's a really important safety thing. Whether or not they have to prove that they're vaccinated is a different story, but I think it should be open to people who are vaccinated. I don't know if people agree with me on that.
I think that especially where they won't be having masks, they are indoors. If you felt comfortable with us giving you that guidance, I certainly, it's safer if everyone is vaccinated.
It makes perfect sense. The thing I struggle with is that it's the enforcement of it, right? And that's the issue.
No, I'm not sure that we're asking you to check passports or things like that. We're not asking that. But what you could do is say that
advertising it that way, I think, would be the main thing to do.
I think that's reasonable and appropriate, and certainly at this point, given the situation, what the numbers look like today. And again, I come back to, we understand we may need to cancel the thing 2 weeks out. So we certainly don't want that to happen, but that's part of the contingency planning that we're going through as we contemplate this whole experience.
So I had a couple of comments as well. I thought that, again, the parts that you highlighted in the plan sound very good. There are two things that I had thought of that you might not have thought of, or maybe you have, and just to hear your feedback on those. One is, I don't know how long people are at the event, and whether, if you're cutting it down to 75 kind of people sitting down together, whether it's possible to have 2 shifts. Is that too much of a burden on staff? It sounds like you're turning away a lot of people that would like to volunteer, and you might not be serving as many people as you would like. So is that an option where you had 2 sitting shifts? And then the second idea that I was thinking of was that when I go out to a restaurant and I have leftovers, in order to try to minimize the amount of handling of people's food, sometimes they bring over one of those clamshells and they, have you scoop your own food right into a clamshell, and that way nobody else is touching your food. There's no shared saran wrap that's being passed around, or your food's not leaving your table and going with someone else while they wrap it up for you. And so I didn't know if that was something that you had thought of either.
So 2 points. So we really struggle. We've certainly considered going to multiple shifts, and the issue is it's just the physical limitations of the facility and the complexity of managing that with the volunteers, at least with the current facility. So at this point, we've set that aside, but it's certainly something that's out there. Given the demand for the event on Thanksgiving Day, where we were in 2019, obviously that was an issue that we were having, and we just struggle because that facility is right at the edge in terms of where it's at. So at this time, I don't want to do that. A point that you didn't make, but I'll just bring it up and clarify. In 2019 and in years past, we traditionally would serve at 1 o'clock sharp, and majority of people would arrive basically at about 12:45, and you're seating people and kind of getting people settled. By 3 o'clock, everybody was out of the facility, generally. There might be a few people washing dishes, but 90+% of the people are out of the facility 2 hours later. Now that was with a dessert buffet and with an elaborate process for seconds. By going to served dessert and simplifying the whole dessert process, that's going to cut the duration of the event by at least 30 minutes and probably 45 minutes. So we're probably going to reduce the duration of when people are in the facility probably by 35-40% by going to that particular scenario.
Good. Well, I'd like to point out that one way to maintain distancing and separation is with the time, and having, I tried to talk to the schools about that and had the same reaction, that it's just logistically way too complex to kind of do that. And I appreciate, what you're saying. But I do think that the other protocols that you've mentioned, I have no problem with guidance saying that it can go forward as of now with the guidelines that you've set forth. And, to be revisited, and we'll watch the data, and we'll try to keep you in the loop so that you know.
Yeah, the only thing you might want to consider is having people mask if they get up and go to the bathroom, or those kind of things like we used to have in restaurants. But I'm not sure that's absolutely necessary right now, but it might be something to consider.
Yeah, and just to respond to your other point about the leftovers, many of the individuals that are there physically are not even capable of moving the food from their plates to the clamshell. So they're typically waiting for a server to help them. So it's really a matter of trying to figure out a way to manage it, to have as little handling as possible, and having multiple rolls of saran wrap around so that the individual waiters can just do it right at the table, so you're not moving back and forth. That's what the thinking is there.
And Alan, do you have any other comments? No?
No.
Good.
Thank you
Joe.
for your
Appreciate
time,
it.
and thank you very much for your feedback.
And so I think that as general guidance then for the other indoor activities where there is food being served, I think that all of those points that Joe brought up are probably applicable to those other events in terms of trying to have it at less capacity than the spaces, the way that the servers are all masked, trying to encourage, post these as events for vaccinated people. Are there any
Well,
other
I think
things that we'd like to kind
the
of-
events that came up indoors, I'm trying to remember, was the fair, the indoor-outdoor fair. In
The Veterans Luncheon too, as well.
The
what?
Veterans Luncheon.
Veterans Luncheon.
Yeah, that's probably more similar to this one.
How big, is that at the senior center?
About 100 and 125 people.
Where does it take place?
Actually, at the senior center.
It's that big, 100 people?
it's veterans, spouses, widows, whatever, anybody that's connected to that
And where does that happens at the senior center?
at the senior center.
Do you know what the capacity of the space is there?
240?
Yeah, so it's about half
250.
capacity.
So it is. And I actually would love to see 125 people there this year, but I don't anticipate the number will be that high. And we still have a lot of people who just don't want to be in rooms full of people, and I get that.
Can we give a decreased capacity recommendation? I mean, is there a number that I almost think we should be following similar guidelines to the Thanksgiving dinner, because it's a similar type of event.
Right, I just believe they already are
Right,
limiting because
right.
they're cutting it in half. So I just would hate to see someone that's a veteran be not allowed to participate when they're already cutting it in half by the allowed people that they usually expect to
I'm
attend.
sorry, the capacity's already being cut in half?
Yes.
So the capacity of the
okay,
room
I
is
missed that.
250.
Sorry about
yeah,
that.
Or
Okay.
240.
Sorry.
And I assume that this event would also be one that's hard to kind of split into and have two different times just because of the way that people want to see each other and socialize. And
2 years ago, we had 16 World War II veterans there. So, we tried, and like I said, we've already, for everything we do there, we've already limited the number of people at a table. We've spread the tables out. I mean, but I would hate, I appreciate your guidance, but I promise I'll keep an eye on it. I don't want to say to somebody, we've hit our 80 people, and yes, I know you're a World War II veteran, but you can't come.
I agree.
That would not make me happy. And I wouldn't want to have to do that to somebody. Like I said, I would love to have 125 people there, just like we used to. The biggest event we had at the end of the summer was the picnic with the firefighters, and we had about 75 there that night. So, that will be, and sadly, we've lost a lot of our World War II veterans this past year, so.
actually, you want to jump in? I've got one other comment after that.
Yeah, so will you be taking the names and addresses of the attendees? Okay,
Names, addresses, and phone numbers.
good.
And I think before the event, the other thing that might be useful, especially if you start going over 80 and you're in 120 or whatever kind of range that is, to let the people know what the expected attendance is, and that way they can kind of get a sense for themselves as to whether they want to attend. I'd rather have people know ahead of time before they show up that it's 120 people are going to be there versus 30 people are going to be there, because that could actually change some people's minds as to whether they wanted to come or not. And so, I mean, these are the veterans that we're talking about. They've done a lot, and we want to, they've made some, choices in their lives, and, we want to respect that they're, capable of continuing to make decisions. And so we'd like to empower them rather than to just tell them that they can't come up to the event.
So are you going to also have volunteers masked and servers masked? And
No, the caterer will provide masked waitresses. I don't
Okay.
have volunteers doing any of that type of stuff. For any of these events, I've got the caterer who follows all the protocols. So.
And do you, can you ask the caterer if their staff is going to be vaccinated? Is that something that you can ask? I mean, it maybe not required, but certainly put pressure on them.
They all are.
They all are vaccinated.
Yeah, we
Excellent.
get our food from them for our grab-and-go lunch and also our dinner at the back door, and they've all been vaccinated, so. And I'm not sure, can I ask that question?
yes, you can ask that question.
I can? Okay.
I
I
mean, they might not be able to answer that question, but you certainly can ask the question.
I mean, I was at an event Saturday night in Northampton, and I had to have my vaccination card and my license before I could even set foot in the building. That was required. So, I get it. And I don't think people would object to that, but I was told I couldn't ask people coming in the door, so.
I think the problem is not with the asking, but on the enforcement. What do you do once you've asked the question, they've answered? So, I don't think there's a problem with asking, especially of somebody that you are hiring, like the catering company, asking them if they are vaccinated. There's, no problem asking them that question.
So for the veterans luncheon, can we also ask people who are coming be vaccinated?
That's up to you.
That I would
But
recommend.
it doesn't limit them, correct? Is that what you're saying? They
I'm
can,
saying,
we
I'm saying
ask.
that it's advertised as, please join us if you're vaccinated. But I agree, I don't think it needs to be enforced
Okay.
at this time. I mean,
I would prefer just to simply have a statement, and I'm happy to make a motion to this effect, that the Board of Health recommends all attendees be vaccinated. But, anyhow, that would be my approach to what you're suggesting.
I mean, I've been to events, in various groups that I belong to, and it's certainly required in a lot of the events that I've been to. So I think it's pretty commonplace. I mean, this is a big event, and but I think it should be on the invitation, is what I'm getting at,
That's fine.
in my opinion.
So I think that takes care of the biggest ones we have. We've gone over to some degree on time on this, and so the question is, what other events have very soon deadlines that kind of don't fit into the categories that we've talked about?
For inside would be the fall fair at the senior center, which is in and outside.
And then the Halloween something or other.
Yeah, we have a 1026 Main Street Trick or Treat, which is outside, but also visiting buildings. And then 1029 is the recreation Halloween party at the Gibbs Middle School, which is, DESI guidelines require
And-
masks inside the school.
And so the fall fair that's inside and outside, are people eating at that? Are there tables?
No, that's also at the senior center.
Yeah, and so if we just had masks be required there, yep,
We do have lunch that we do, and it's all made on the premises by the same people that are cooking Thanksgiving dinner. It's beef stew, corn chowder, I forget what the third thing was. And it's all served in individual cups with covers. I mean, it's always been that way. Cups with covers. A lot of people take it and leave. We could still do that part of it and have people take it like with them if they wanted to, but we usually do coffee and donuts in the morning, but we'll skip the donuts.
I think if there's a lot of people coming and going to tables, I would recommend it be masked, and,
And that's fine. I fully intended to have that be a requirement just to walk in the building. My concern was more about the capacity, like, would I have to limit the number of people who are physically in the building at a time? So like I let these 30 people in and then count back and then let the next 30 people in.
so the more we know that everybody there is masked and vaccinated, the less pressure there is to kind of maintain that social distancing. All of these things work together. It's a layered approach. The more you have of one, then you become less dependent upon all the others, but kind of it makes a safety net when you have lots of layers in there. And so if people are getting soup and eating that or stew, and they don't have their masks on, and maybe they're vaccinated, but maybe there's some people that are coming that aren't vaccinated, those start to increase the risks and are more likely to have us want to kind of, really control the number of people that are, in that room together, if that makes sense. And so the more that certain things are definitely in place, the more, lenient we can, we feel about some of the other process. I hope I speak for the board when I say that, but that's kind of my impression.
That's why we anticipated attempting to put a couple things outside of the building so that we have more room inside, so we could spread the tables out more. We only have 6 tables that we set up for people to eat at, so that's 36 seats. So it's not like there's going to be 50 or 60 people sitting down eating at any one time, and we anticipated putting some things outside so that we could spread things out further in the building so there was more room for people to move around. So as long as it doesn't snow or it isn't 20 below zero that day, we're all good. That's happened, so that's why I mentioned that. But
Good. No, I think that, the guidance that we're giving hopefully is something that you can work with. It's maybe not you know, one of the issues we struggle with is going very specific on one event versus trying to make the guidance a little more general. And I think that we've, you know, story after story of these ones that we focused on, you know, can give a little more guidance into these cases, so.
And I appreciate that. I mean, I know that our population is more vulnerable than most, although it seems that we've sort of moved to children now as more so than elderly adults. But it's just, I mean, we've worked very hard to keep people safe, but we also want to bring back some normal to them. You know, and the fair was going on long before I got here, and that's been a very long time. So, and the same thing with the Veterans Lunch. We started at the 50th anniversary of the end of World War II. That was a few years back. So we've, you know, these are traditional things that people look forward to, but I also know that they appreciate the fact that there are limitations to what we can do and what we serve and how we serve it. So we do the best we can, I promise.
Thank you. Any more comments about indoor?
I'm sorry, the fall, the trick-or-treating, the town trick-or-treating, so do kids go into each business to get candy? I don't remember.
As
bringing-
far as I know they do, I'm not really
Just
familiar
wondering
with
if that, they
So I
can
know
move the candy towards the door
I
kind
think
of
we've only
thing?
done this one year and then it was
Yeah.
canceled last year. So, great, go ahead, Kim.
Please.
We did this for the first time in 2019, and it was largely here at Town Hall, the municipal building across the street, the fire station, and the library. We were hoping this year to resume that and include some of the businesses around our buildings. I think if it's a nice day, many of them had thoughts about just being at the door or setting up right outside. Through Town Hall, we had a steady stream, but it was never overwhelming and kind of mobs of children at once. It did tend to be a younger crowd, I believe, and we were looking to do somewhat similar to what we did last time. Each of the offices within the building had candy to distribute, but we tended to do it in a way that, you know, we're at the door. If it's a small office, they're not having to come in and kind of congregate in close quarters.
And what do you think the perception or receptiveness of the kids to be wearing masks as part of their Halloween costume while they're doing this? Is that?
The younger kids?
Yeah.
I think they
Yeah, they're
have
12
no
and-
issue with it because
Yeah.
that's
Yeah.
what they're used to
They're
in
used
their
to it.
daily life.
I mean, I don't see much more that we'd want to give in terms of guidance than masking at an event like this that's mostly outdoors with some, you know, in the town hall type of stuff. I don't know if you feel there's anything stronger than that you no? So I think that I personally would prefer that they're masked as they group together and, you know, whenever I went trick-or-treating, it was never by myself. It was always in a huddled
Yeah,
group
I
of
think-
crowded masses.
Is this where the kids are coming around by themselves, or they mostly come around with their parents?
Mostly with parents. It tended to be younger, honestly. I would say it was probably even the preschool, very early education crowd was what we saw last
Oh,
time.
okay.
So most of them came through with a parent,
Oh.
and it was,
I'm personally indifferent to that population as far as the masking. I mean, they're not going to be indoors very long.
Okay.
I'm not opposed to it, but I don't feel compelled one way or the other.
Do you feel it should be?
I think if little kids are going in and out of buildings, they should be masked. The only other thing too is, are people giving them candy or are they taking candy from bowls kind of thing?
I think most of us figured out with that age group, it's wise if we give them the candy. So
Yeah, I would
think-
recommend that,
Yeah.
even though,
And they
you know.
do move through quickly. As soon as they
Right.
realize there's another office with more candy, they move through quickly. But we can certainly give that guidance. And my expectation is we could also ask staff to be masked. And many of the, you know, I think to your point, a lot of the kids will be masked because that's what those of us with young kids have just gotten very used to, as well as, you know, I think some of the costumes add that extra protection.
Yeah, I think that going as far as saying that that the kids need to be have a mask on, is kind of where we should be. I know that you're on the recommendation side, but are you comfortable saying that it should be required? especially when they're
I-
indoors. You know, I don't know how easy it is to take on and off as part of a Halloween costume, but for those
Can-
times where they're indoors at this event, I think that everyone masked is good.
Can I just say
Sure.
something? It is a requirement for 12 and under that's not eligible vaccine to be masked anyway, just so you're
Yep.
aware.
Good.
Remember.
So that'll be consistent then
Yeah.
with the other guidelines out there. Excellent. But no, I don't see any problem with that going forward, so.
Okay. Thank you.
Excellent. And I think that this kind of, to anybody who's watching and trying to figure out about their outdoor events and things like that, or individual businesses that are doing stuff, hopefully we've given a lot of guidance to these groups publicly on this meeting, and so that you can kind of interpret where we stand for those other events. If there's something more specific that either of you wanted to talk about with this, is there anyone in the audience that was specifically wanted to comment on this? Excellent. Let's, I think we had the Harveys next on the agenda, or the recycling.
Waste Management Task Force.
Yes. And so we have some people here to talk about that. If you guys want to come up. Sorry for the long delay.
I sent the slides, if
Yep.
you just want to put those up so I don't have to connect my computer. We were last here in June.
This one happened already.
Paula, can you pull up what she's referring to?
I can put
Do
it
you know
up
Do you know who you sent them to?
to Paula. I have it.
Yeah. And
Did we get it in our packet?
I didn't see it.
I got them.
I had one, which is the one that you have right
It's
there.
just that.
Yeah, right.
Oh, that's cool, you can see them, even though going up here?
No, I have an Excel kind of table about the count tonnage. That's what I have.
Yeah, this is from the office.
Okay.
We don't have their slides.
Okay.
It should come up on the screen now.
Do you see the slides over there?
Not yet.
Not yet.
No, I see basically these black screens.
And I
Can
don't
it-
think we've met Jennifer.
Yes.
I think everyone else knows, but I'm Scott Kadish, and I live at 45 O'Neill Drive.
Hi, I'm Nathan Askew, 55 Fisher.
Hello.
Katie Curtin Masted at 26 Linda Street.
Nice to meet you.
Probably see you a little more.
Yep.
Welcome.
So do you have the slides? I sent them.
There it goes.
Okay, all right, cool. So I think we were last here in June to discuss issuing an RFP for a new town-sponsored curbside program. We were asked in the last Waste Management Task Force to look at how our current curbside program compares cost-wise to other curbside programs, to really make sure that if we're going to embark upon issuing an RFP or an interest form, that we truly believe that we can not only have a better program for Westborough, but also a more cost-effective program. So we did complete the requested analysis, which you can see here. We looked at 3 towns and their curbside programs. So the Westborough program, as we know, the curbside program is a hybrid program. It's weekly curbside trash, every other week recycling. The overall cost per household is $715.78. That breaks down as follows. Residents pay Harvey's $48 per month, which is $576 per year. And then the town pays for the trash handling fee and also pays the tipping fee at Wheelabrator. And so if you calculate our trash tonnage from 2020 from DEP by the household served, by what we pay for the trash handling fee, what we pay for the tipping fee, that comes out to an additional $139.78. So the all-in cost to the town is that number. If you look at Hamilton, Hamilton has weekly curbside trash recycling and composting, 35-gallon waste cart, because they're trying to encourage people to recycle and compost. Their entire program, which is absorbed into the tax base, is $235.48. And residents do pay for additional bags if they have more trash than fits in the 35-gallon waste cart. If you look at Hudson, Hudson has a completely private program. It's 100% private. The town of Hudson is not paying for any of it. And Hudson has a variety of providers, but we were able to find info for Mr. Trashman. And Mr. Trashman has weekly curbside trash and recycling. Households are paying anywhere from $504 to $564. So based on this analysis, we're very confident that if we move forward with the RFP or an interest form, we should be able to have a curbside program that is not only better for our town in terms of helping us to reduce waste, but should also cost less, looking at these two comparisons that we found.
You have a question?
Next question is, in terms of what these programs provide, you're looking at the curbside trash, recycling and composting. What's the story with bulky items or things like mattresses or electronics? How are those towns, Hamilton, Hudson, managing that?
I didn't look at that, but it's very typical that curbside programs have extra charges for bulky items.
Okay, because for the most part, that's covered in the Westborough all-in. So if you want to do an apples-to-apples comparison, you'd want to get that data.
I just think we're at a point where, like, we're looking at there. Even if we were to add the bulky fees, the bulky items, we're looking at our program costing $715 compared to other programs costing $235 to $504. The ask is really to move forward with the RFP. I mean, I think the data is clear that we're going to get proposals back that are going to cost less than our current program, and they're probably going to be better for our town.
I believe Westborough also charges a fee for bulky items down at the transfer station right now.
For some things they do charge. That's, again, this is where you want to make sure that you are doing an apples-to-apples comparison. We also get yard waste that we
didn't include bulky items. We didn't include yard waste. Again, I'm pretty confident that if we went and chased down those additional details, I'm pretty confident that our program is more expensive than comparable programs. And what we're asking for is to move forward with the RFP.
The simple thing to do then would be just to back out the cost of those things from the Westborough numbers.
The Westborough numbers for curbside don't include bulky items or yard waste.
They're covered in the fees paid by the town to Harvey's, though. I mean, they're in your 715 number.
So that would only make up the $139 portion of it. That has nothing to do with the 576 number, which is just the private pickup of trash and recycling.
Go ahead.
The bulky item thing is kind of confusing because the curbside people have to pay extra for bulky items, right? If you
In
want
all three
sofa
cases.
picked up or a TV picked up, so we're not talking at all about the transfer station. We're just talking.
We're talking about
only
curbside
curbside.
programs.
This is just curbside.
So this is, you're saying people who use Tidy Town are paying $715 a year if you include what the town's paying on their behalf.
The total cost to the town, like if we asked people in our town to pay the complete cost, it is costing per household $715.78. What people aren't seeing, because it's just absorbed into the tax base, is what we're paying the tipping fee and the trash handling fee that we're paying for the curbside. If we had a completely private program, which is the Hudson program, keep in mind Hudson, the town of Hudson is not covering any costs of any curbside, vendor who's active in Hudson. Even that program at $504 to $564 is less than our program.
Can I ask a question?
Sure.
I might not be understanding this, but we don't have a contract with Tiny Town. Is that correct? So is there a reason? But I know we do with Harvey's, but I don't believe we have a.
Tidy Town is allowed to take their tonnage to the transfer station where it gets commingled with the stuff that's thrown over the wall. And then that all is what Westborough pays to have all of that trash, even from Tidy Town, taken to Wheelabrator, and we pay the Wheelabrator fee.
So my question, I guess, would be, is there a reason why individual households can't contact a separate waste company for curbside pickup?
They can. There's just no one else active in this town. There's no other, I mean, there really isn't any other option in town.
So if you called like Waste Management, they wouldn't come here to pick up?
Not to mention that Harvey's charges $75 to pick up each of the bins. So for some people, that would be $150. For myself, it would be $225 just to change service.
Right, but
But of course, getting a town together is going to, in theory, reduce the cost.
And again, we're really here, again, we're not here to have, what we're here to do and what we were asked to do is we were asked a simple question. Would it be worth it to issue a RFP? Would we come back with proposals that are going to cost more than our current program? That's what we were asked to do. And the data clearly shows that our program costs more than other programs. So it's just very clear that it's good business for the town to get a RFP out or an interest form, whichever one we want to do, because we're pretty confident based on the data that we can get in on a program that's going to cost the town less and hopefully provide better service to our residents.
Yeah, so I think that, Jen, just to jump in, one of the things that has happened here in Westborough is that because there's not a lot of demand for a new company to come in, they don't have lots of routes that can kind of justify bringing a truck through town. Whereas something like Hudson, where it's kind of open and so there's no established program, it's kind of ripe for, several companies, it sounds like, to all kind of service households in Hudson, and so they're all competing with each other. That's a situation where, the price is, the $564.
And Hudson's not even satisfied with this. Hudson is right now going to do an agreement with BP, and they're going to have Hudson residents pay the town. The town is going to pay BP. And again, the town is not going to cover the curbside program, but the reason that they're doing this is they want to offer something lower than that $504 to $564 that the private haulers are charging.
Yeah, so that would be one aspect of the RFP, is that then once you have a group of people together that say, this is what we're all going in together on, you can kind of drive down that cost as well. And so whether you have individuals competing or...
What did Webster have?
It was individual pickup, household pickup. And if you had big bulky items, you'd bring them to the compost or the trash company,
And
the waste facility.
And I'm assuming you're just starting to understand how our town breaks it down.
That's what
So,
yeah.
So we have a good segment that do curbside and a very good segment that also do transfer station. And we are not talking about the transfer station here. We're only isolating our curbside folks.
Okay.
And they are paying a lot more than other towns for what we thought, would in theory be a pretty good deal because it's an in-town, right, it's a hometown discount, right?
Right, all right.
But from what we found here, it doesn't look exactly like that.
Well, the other issue with Westborough, which I think brought a lot of you together to do this in the first place, just for Jen's sake, is a lot of people in town are not happy with the fact that they have to pay extra for recycling, whereas in other towns it's more encouraged to recycle and
compost.
And compost, I'm sorry. And so basically you're paying extra, so to recycle, which I'm assuming a lot of families don't do because they don't want to pay extra.
Thank you.
We're not at this point making a commitment to sign the dotted line with any vendor. We're just asking to get the okay that we can proceed with either issuing an RFP or an interest form. We learned from the town of Hudson that as relates to trash, you don't have to do an RFP. We can do an interest form, so either of those options are available to us.
Let's see, I think Christy had given some comments about, how the RFP needed to be structured. I don't know if your group has actually talked to her or whether that's one of the next steps that has to happen, but she seemed to think there were some pretty strict things that had to be in the RFP.
We structured the RFP based on the DEP RFP, sample RFP, but again, if we're getting the go-ahead to issue the RFP, which is what we're looking to get the go-ahead to do, then we'll work with Christy and whatever department she designates to review the RFP. We did actually try to get the RFP reviewed, but it was premature, right? Because the Board of Health hasn't yet even given the okay to the consent.
Right. Paula, you've
Well,
got
I just
other
know that
comments?
Christie told me that committees can't issue RFPs. The RFP
Okay,
would
has
have
to come from us.
From you or the town manager's office.
Okay. But we could certainly have the committee draft the RFP so that
Well,
we
yeah,
could then issue
It's
it.
gonna have to be reviewed by council, and
Yep.
it's very laborious.
Okay.
Yeah.
Do you have more slides? Is this the only slide?
Because the other slides were reviewed in June. So our ask at this point is we get the green light to move forward with the RFP or the issuing of the interest form as whichever is most appropriate. And Paula, to your point, with the appropriate groups within the town.
Do you have any comments, either of you? No,
I guess this is the first I've heard of the interest form, and that may be a simpler thing. I don't have an objection to that.
Yeah, Kelly, who's the head of the, she's the town, she has a similar role to Jennifer. She's the one that mentioned that they went interest form versus
Hudson?
RFP. So it might be easier way to go.
I can speak with her as well. I
Yeah,
know her.
so I mean, so since they did an interest form, it was much easier and they selected BP. So we could probably go that route.
Yeah, I think that based on the numbers here that you've collected from these towns, there's definitely, price savings that could be had by those residents that are using the current weekly curbside trash and recycling. We just want to make sure that whatever we do is not set up in such a way that it is kind of an exclusive where then like everybody in town has to go with it, because that obviously changes, a lot more than if it's just, this is what the town is kind of pushing and, helping with.
Yeah, I mean, we're looking at 2,200 households and a savings of $150 a household. We're not even talking about Hamilton. That's over $300,000. That is a lot of money, and that's not even the best deal. So over a number of years, we're talking in the millions that our town has. The curbside people have been sleeping. We've been asleep at the wheel in terms of what we're paying. So I think it's about time that we at least move forward and get an interest bid out.
Yeah, and then I guess on your point about exclusivity, there's only going to be one vendor selected for the town-sponsored program, and only the town-sponsored program will the town pay the tipping fee. Any private hauler who wants to provide services in town, who believes that they can offer better alternatives to residents, are free to do so, but we're not covering, the recommendation is, and this is consistent with other towns, we're not covering the tipping fee. The tipping fee is only for the town-selected curbside program.
Does everyone understand what the tipping fee is? It took me a couple times to get the tipping fee. It's just a cost to actually transport the waste and dispose of it from Harvey's to the endpoint.
Whoever the hauler, whoever the curbside.
It would be
vendor is,
wheel
yeah.
operator in
Yeah.
this example.
That does actually raise us, well, it is, no, it's fine.
So I think we're good.
Yeah, so I think that you've got our blessing to kind of move to the next step to kind of draft that document. If you can't issue the final RFP and it's got to come from someone else, then, obviously there's a few steps that have to happen before that point anyway, but I think that is good. I mean, I think that just preserving those people that don't use curbside and making sure that they're not impacted, I don't see any problem with moving forward. I mean, this looks good.
Yeah, we're just talking about the curbside people.
Yep.
And the savings. We're not talking about
Exactly.
the
Transfer station.
One iota.
Yep.
This is just curbside.
No, and if we can get those numbers down to 235, you might actually find a lot more people deciding to do it as well. So, it could swell as we, drive the numbers down.
Yeah.
We'll see.
Yep. Good, thank you. Anything
Okay.
else you guys have?
No, thanks.
Appreciate you hanging in there for us.
Yep, thank you.
Nice meeting you.
Okay, so now we're moving on to the Vote to approve the minutes from August? Well,
move-
August 10th, right?
Oh, let me see.
We don't have minutes for the 24th meeting, correct?
No, those come from seal. That's the one that was a joint meeting with that board meeting. Those will come from the select board.
Okay, so when we get those minutes, well, we can approve those at maybe the next meeting.
What?
The 24th, you weren't here, that's when Sealer did? That was the
Yeah, but
joint meeting?
typically,
Oh, is it on
Was
the
it
back end?
something?
Oh, they did add it on the
Oh,
back
good.
end.
Okay, so this would be the minutes for August to the 10th and 24th then.
You're good. You're okay.
Okay, I move we approve the minutes of the Board of Health meeting, both the August 10th and the joint meeting with the selectmen.
I second it.
All in favor? Aye? Did you say yes?
Yes.
Yep, okay. And so then the next item was the director's report. Under the housing section, in the very first paragraph, there was a sentence that I didn't know if something got cut off on the PDF form. It basically read that the management company offered a unit that was comparable and will
Oh, yes.
do something, and then the occupant is relocating.
Yeah, so, I'm not actually sure what that was supposed to say, but it basically, the unit was offered to the occupant, and the occupant is now gonna be moving into, has moved into the new unit.
Okay. Any other discussion about the director's report? Do we have a motion?
I move we approve the director's report for August 2021.
I second the motion.
All in favor? Aye. Looks like there were 3 hands raised. The sanitarians report?
Interim director at
Oh.
sanitarian.
I was still
Yes.
interim director at that point.
Okay.
My last one.
I had a question about that lifeguard pool company group. If they're still doing this behavior, can we forward this to the town attorney to maybe take some sort of legal action or something, or at least ask the attorney?
I don't know if
what
there's any,
recourse there could
he's asking information. The company, the housing facility called me and said, we will send you any information that we request, just take information from us or our CPO that we send you at the beginning of the season. That's it. So it kind of got handled.
Well, I'm more thinking like, do we need a cease and desist order against this individual or this company so that they stop kind of doing whatever this behavior is? Because this, I mean, is not the first time they've done it. It seems like it is, you know,
I think
pretty
he's trying to build a
disingenuous.
business and he's doing it the wrong way.
Yeah.
If it continues, if it starts off at the beginning of next season, I'll come back to you. But at this point, I can, now that I know that nobody wants to deal with him, I thought when he called me that he actually worked for them and that he was trying to help them out, and he wasn't. He was trying to push out the other person. They had shut the pool down for another reason, and he went in there and said, oh, she's shutting the pool down 3 weeks early, and they want me to keep it open. Well, it was the residents that asked him to keep it open because he was a lifeguard there, and he can't do that. He doesn't have the ability, he doesn't have the insurance, he doesn't have any of that stuff. So I told them I'd wait to hear from the management company. They called me and said no. So I don't see it be, I can handle it when it calls in. If he calls in again, I think it's an issue, then I'll come back to you, but I don't think it's an issue.
I do believe it's the actual place that he's representing, as we quote unquote, that is responsible to hire the attorney and go after him that way. As us as CPOs, we would contact the actual place and make sure that he's actually representing them. So I think
Okay.
it's more their side.
Okay. I don't know, maybe I just misread. I thought that there was this person had been talking to different companies
Yes.
in town, and
That was before Jen got here, so she doesn't know the history on that gentleman. Yeah, that was back in June where he was going around to pools and trying to call me and tell me what's wrong with all the pools and that how they weren't doing this right. He didn't know that they had variances, that they didn't need a lifeguard. He's telling me, oh, the Boston Sports Club doesn't have a lifeguard, so they don't need one. Well, yeah, they do. I said, no, they have a variance. They don't need one. Oh, okay. So,
Right, and I think it would be different if it was acting as a public health entity, but he's not, or a staff member. He's acting as a CPO, which is not related to us, so it would be the businesses. I've run into this prior, so that's why I know this, just so you know.
if it comes up again, bring it up before the board, and we can decide the best way to advise you guys. Anything else on the interim director sanitarians report?
I move we approve the interim director's report.
I second it.
All in favor?
Aye.
Aye. 3 hands were raised. Health inspectors report. Do you guys have any questions or comments there?
I was just questioning the dates next to the restaurants. Are these,
So those are the last inspection dates.
oh, okay, all right.
We've have some restaurants that are on probation and they get visited more regularly, and then we have ones that are more yearly. And in the past, before we kind of implemented a lot of these, things were almost on like a 2-year review, and so we've kind of had the inspectors put the dates on there so that we know whether, kind of what time frame this has been since they were last inspected.
Got it. Thank you.
I didn't have any questions this month.
I'll make a motion that we accept the health inspector's report for August.
I second that.
All in favor? Aye. And let's see, then there is the October meeting date that we have to set. Or is there other things that you want to talk about? Yes?
The third, I was just gonna say the third Tuesday is the 19th.
I couldn't hear what she said.
The third Tuesday is the
Oh.
19th, I think
So,
she said.
I noticed it's not on the agenda, but often there are director's issues. Anything you, I didn't want to, for.
Yeah, actually, that's a good point. Thank you.
She kind of erased it.
If you have no issues, to bring up, I do have one thing I'd like just to briefly mention before the board. So I just want to make sure everyone had heard that Harvey's has been sold.
Oh, we did not hear that.
Yes. I only heard about it because we went to a meeting with Ben related to the Waste Management Task Force. So Harvey's, you can fill in, you're going to know more, but Harvey's has been sold to a national waste management company. Ben Harvey is going to stick around for at least 2 years, and is it his nephew?
BJ, his
Or
son.
son? His son will be a regional manager for at least 5 years. But
And they don't predict any changes, and our contract going through June is completely fine and will remain. However, if there's any question after that, they will notify us first and foremost. But they don't see any changes coming.
Okay. They still view this as operating as a transfer station, right? People bring
yes,
stuff in,
everything's the
things go in,
same.
and they get
In
moved out.
fact, locally, they're going to keep the Harvey's name
Okay.
on the facility.
I did have 2 things that I should discuss with you. The first one being, we were only allotted 20 flu vaccines instead
20?
of
20?
Oh, no.
20. And I called CPH and asked for more, and they said, we can't do that. We're only allowing 20% of requested.
I
So
placed an order
normally,
for 80.
normally vaccinations for the clinics are 80, and I spoke to the school nurse and the public health nurse. We can't hold a clinic with 20. I tried doing something else with it. I was hoping to do homebound seniors, and I was denied. So I'm going to
Wait,
the...
you were DPH denied you?
Yes. So I'm either going to return them or give them to our public health nurse to be able to use elsewhere, because she holds a
Can
lot
you
of
offer them to staff?
No, only for children.
5 to 18 is all
Oh.
we can use them for.
So,
Okay.
So we'll be referring people to St. Anne's in
St.
Shrewsbury,
Anne's and Shrewsbury.
who does all childhood vaccinations.
okay, going to St. Anne's is fine. Are you familiar with St. Anne's?
No.
I'm not.
It's a free clinic, just free healthcare, staffed by volunteers. They do a couple evenings a week, is that
Yeah,
what they do?
that, I don't know the hours.
Yeah.
So I'm sorry, you were talking about pediatric flu vaccines? What about adult? Are we not getting anything?
So,
We never
No,
do
we
it.
typically don't get
Oh, really?
those for the past, I don't know,
Yes.
so
5 or 10
So the
years.
program that we're involved in, the state sends us vaccines. I'm the vaccine coordinator for the town. I order free vaccine. We get the juvenile, but they're saying you have to use a 20 before you send you more. Last year, we've been getting 80 every year, and last year they sent us 200. And we were like, we don't want 200. Oh, no, you're getting 200. This is because we want to make sure more people are getting the flu vaccine, and we use 79. So we ordered 80 this year, and they sent us 20. So we can only use it for juveniles,
Got it.
and I think Jen said the rest, that that nobody's gonna run a clinic for 20 people.
Right,
Yes.
okay.
You said the
There was
two
a
items,
second.
I
is that
did,
one?
and I have no idea what the second one is at the time, so.
Can I ask a question? I feel like we didn't finish discussing, because the select board left, whether or not we want to make a mask mandate in municipal buildings and spaces. Is that something we can continue discussing?
Yes, I believe that it's still something we can discuss. I think that if you want to walk through some of your thinking, I think that's probably appropriate.
I just reviewed which towns in Massachusetts are doing that. There's over 300 of them, towns and cities in Massachusetts already doing that, in municipal spaces, obviously less having a full mask mandate indoors. I've already expressed, my thoughts on that and why I feel like it's important, but I don't know.
Yeah, I
How do you
mean,
feel?
so my thoughts on it are that the measures we put in place are important for specific purposes, and the purpose of kind of having a mask mandate in municipal buildings is if we think that that's likely to spread the virus around, and whether we think that that's, going to be helping solve a problem, and then trying to figure out what is the risk and what's the benefit, and trying to make that
I think
risk-benefit
there isn't
analysis.
any risk to masking in town buildings. I mean, I think there's only a benefit to masking in town buildings, and also meetings, town meetings. I mean, we already talked about the big town meeting, but
So there are some people that, when they wear masks for extended period of time, they do develop headaches or migraines and, other types of issues that they just can't do it for very often. I think that, especially for people that might have an office in a public building, if you make them, a mandate that's around the issue of everyone in a public building has to wear a mask, then you do kind of pigeonhole a lot of people that might not be at any risk of spreading it, and, kind of cubby-holing them all in together. And so we do have to, any sort of policy that we want to think about, you'd have to kind of craft pretty carefully. But I do think that, I don't know, I'd also like to hear Alan's comments too on this topic.
So I do think that there are always downsides to things. And when it comes to COVID public health issues, I think it's really important to emphasize things that we have reasonable degree of confidence are going to make things better. Because otherwise, at some point, people start tuning out all the messages because they get fatigued by the various rules and regulations, or they see, as we have seen in the news repeatedly, situations where public health officials will say one thing, everyone needs to wear a mask, and then the public health officials, or not public health, perhaps the politicians, are then caught not wearing masks and give some kind of lame excuse, and it undermines the confidence in important public health measures. And so I want to try and propose solutions that I think will materially make a difference, and I'm just not convinced that asking everybody who comes into a public building to wear a mask is going to reduce the impact of the pandemic to any significant extent. I'm not aware of any data that would suggest that, and based on the contact tracing we do in town, there's no evidence to suggest that this is going to help. And if it's not going to help, then I don't want to do it. If it's going to help, then I'm happy to do it.
And so there is a situation that you could imagine where we could get to, though, where
Yes.
masking in, public buildings would make sense. I think if I'm paraphrasing what you're saying, is that we're not there yet?
That would be correct. If, again, we're continue doing contact tracing. If we start getting reports that suggest that people who, somebody working in the building got COVID, they believe because of an exposure of somebody who was coughing, who came to pay their taxes or something like that, or vice versa. That would, even anecdotally, that would be something. And I don't feel like we even have that level of information yet.
I mean, I'm mostly looking at surrounding towns and looking at numbers, and I personally think it's the right thing to do to make our, town residents comfortable going to meetings and going into town offices. But I hear you. Certainly, if the numbers continue to stay up, I think that should be something to reconsider. I'm really curious to see what they are over the next 2 weeks, but looking around in other states and other, with the Delta variant, and the number of breakthrough cases is only increasing. We're definitely not seeing a lot of plateaus all over the place right now. So I think it's something we need to keep thinking about. I don't know if there's any other big meetings other than the main town meeting that would expect a lot of people. But is there anything, does anybody know?
I mean, not meetings per se, but we do have, I think right now our only mask requirement that the local Board of Health has issued is on the library.
Well, and then the town meeting, we said.
And now the
right?
town meeting,
Right,
yep.
okay.
So those are the two. The library itself is divided into a couple of different floors, right? And we've got the kids section downstairs in the upper section. I think when we passed our guidance, it was for the whole entire library.
Yeah, kids, it's not like you have to be 18 to go upstairs.
Right.
Right, but we're talking about the risk and how many, unvaccinated kids are actually upstairs crowded together in the indoor space. It's
honestly,
actually probably pretty small.
Well, I think my experience is that the children's library is for, little kids and maybe, up to third graders, whether, if you get, 5th, 6th graders who are not vaccinated, I'd be surprised if they're spending most of their time in the children's section.
Okay, no, that makes sense. So we'll keep that in place. I do think that there's, interesting data from the Pfizer submitting about the younger kids, and so hopefully we'll end up moving in the direction where a lot more of the younger kids are vaccinated. I'd say that so far from what I've seen of the data, the booster shots are looking, like something that we would recommend people getting when appropriate, when dictated by, the CDC or the FDA. And the younger age data also looks very good. So at this point, when that's available, that would be my personal recommendation. I don't know if other people want to chime in on that.
Yeah, I'm wondering if we're getting any phone calls. I certainly am in my office. People are so confused about the boosters, and are people calling the Board of Health and asking? I'm just wondering at some point when, hopefully this Thursday, when the CDC finally makes a call on what they're going to recommend, should we put that out on, on our
Yes,
website?
it will be,
Because
yep.
it's confusing. I mean, I have had too many talks about it with my patients. And
I imagine that the people that the Board of Health has vaccinated, that would be the natural place where those people would look back to the Board of Health for booster shots. I don't know what fraction of that group that we had done would also fall under, this first group of people requiring booster shots. Is there, should we start thinking about trying to get vaccine from the state, or so that we can do another booster clinic, or is it premature at this point to start looking into?
So it is a little premature. However, Chief Purcell and I have been doing logistics
Good.
on when and who, when the guidance comes out. So it is being currently worked on. It's just nothing in stone yet.
There's also where.
Right.
Yeah, well, we're thinking the senior center, because obviously it'll be the seniors that are going to be affected the
Yeah,
most.
65 and up, that would be
Yeah.
wonderful if we could. I mean, I've been telling most of my older patients when it's recommended, to go to pharmacies, but that would be great if we had
Right.
it.
And that's
The
our
other group
goal,
was
is the
the
senior
first
center.
responders that we had done too.
Right,
Yeah.
that should come out on Thursday.
Yep. Good. So as long as you're staying on top of that with Chief Purcell, we appreciate that. And because my natural inclination would be to contact the place where I got vaccinated for my booster shot. And so if you've already started the preparation and thinking about it, it just makes it that much easier when we get a large number of people calling.
And there's also been discussions with a regional collaborative to kind of get things going once we get that okay.
Excellent. Yeah.
What did we give out, Pfizer or Moderna? Or J&J?
Gave everything.
We gave everything.
Depends
So
on
that's
what the
gonna
state
be, that's
allotted.
gonna be pretty complicated too, because I have a feeling Thursday they're gonna come out saying boosters for Pfizer only.
Yeah.
So I don't know what that's gonna mean for first responders and,
And then there was information about Johnson & Johnson now, with
Yeah.
booster being, so that is new as well. So who knows what's coming out Thursday?
well, hopefully something
Yes.
solid, yes.
I personally find the FDA is, I guess good that they're, being slow and deliberative, but I think they seem to be a little bit more on the slow and a little bit less on the
Yes.
deliberative, So a lot of it, I think, from my personal viewpoint, has been the companies have been waiting to make sure that all the Ts are crossed and all the Is are dotted, and that, to me, seems like the biggest delay, more so than, just the FDA approval. It's kind of like by the time it gets to the FDA, it's almost a sure thing. And so while they are doing their due diligence, I think that there's a little bit of room for, us to, as a nation to move faster. I'm not sure there's much the local Board of Health can do, but, I do wish the federal government moved faster.
I remembered my other concern, if anyone's interested.
Yes, we are.
Actually, really remembered my other concern. So we have the partnership with the Greater Boroughs, and we were assigned a nurse for so many hours a week. However, the nurse that was assigned to us, she unfortunately became ill. So they're currently in the interview process to get that nurse to us. So right now we have someone covering our infectious diseases. That's not tuberculosis, because our current public health nurse handles that, and then our COVID cases we handle. So everything else has been shared with the specific head nurse that's been assigned to us. So we don't have yet a person to come here for the hours that are set. So that will be coming shortly. It's just not something that we can offer yet.
Okay. Good. So is there anything else? Or can we?
October meeting date.
October meeting date, excellent. And does the 19th work for everybody?
I'm sorry? what-
Does October 19th, the third week of October?
Do we, I'm sorry, one more question. Do we also have on our website encouraging people to get the flu vaccine? Can we, if it's not,
I don't know if we do.
since it's,
Yeah, we definitely can if it's not there.
thank you,
Yep, I agree with that.
I get mine. I'm sorry, 19th,
Of October.
yeah. I don't see anything.
Good. Well, I
Good.
make a motion that we have our next meeting on October 19th.
Agreed.
Same time and place, I believe, is what we'd prefer. Yep, excellent. Good. All in favor? Aye.
Motion to adjourn.
And there's no current meeting with school committee? Like, I know I had asked you about the October 1st DESI guidelines. There's talk of maybe that changing? From
That it be
DESI?
continued. Yes, that's the
Oh.
rumor, that's going to be, the mask
There's a
is going
rumor.
to, mandate will be
Okay.
continued. But yes, no, there's open communication with the superintendent and I daily, so nothing required yet with the board unless you, of course, want to go through it forward.
Remind me, what date is that current guidance end or expire?
October 1st.
October
Very soon.
1st, okay.
But nothing would change until the school committee's October meeting. So even though the mask mandate ends on October 1st, it will be continued until that following school committee meeting. So come October 1st, if it's lifted by chance,
So
children
the-
will still be required.
The school committee will have to take an affirmative decision to make a change.
Got it.
Yes.
Okay, and their meeting is right around the 19th, or do we know?
I don't know. I believe it's,
I thought it
I
was
don't,
before.
yeah, I'd have to look.
Okay, maybe we can just reach out to the school committee and, not right away, but if the DESI rolls back their mandate and the school committee is going to discuss it, and if they want us to be present, then we can either try to meet at their meeting, so we can give them some guidance, or, we'll just otherwise, assume that they're not taking a proactive step to undo that.
Okay,
Does that seem appropriate?
Yeah.
I will keep you updated.
Good. So to Alan's motion to adjourn, do we have a second?
Seconded.
All in favor? Aye. Thank you, appreciate everyone tuning in.
Thank you.
Thank you.